Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is the nasal septum, free medical education. Internal nose and nasal septum. This is the coronal section of the skull showing right and left orbital cavities, one on each side above, and right and left maxillary sinuses, one on each side below. Between them is a piriform shape, that is a pear-shaped internal nose. The internal nose is located deep to the external nose. The internal nose is divided by a thin vertical plate of median partition called medial nasal septum into right and left nasal cavities. Base of the external nose. This is the inferior view of the base of the nose. Base of the nose consists of two nostrils, that is the anterior nasal openings. One nostril here, one nostril here. Each nostril is surrounded by major alar cartilage B in front and fibrofatty tissue behind. Each major alar cartilage B is U-shaped, consists of lateral crust and medial crust. Lateral crust and medial crust. Singular called crust, plural called crura. Medial crura of right and left major alar cartilage fuse at the midline and form the lowest part of the median nasal septum in the columella. That means the lowest part of the median nasal septum is formed by the adjacent medial crura of the major alar cartilages. This is the ethmoid bone, centrally located at the base of the skull. It is very important bone. Let's talk about the parts of the ethmoid bone. This is crista galli, a thick triangular process above along the midline of the ethmoid bone. On each side of crista galli is perforated plate called cribriform plate. It forms the floor of the anterior cranial fossa. This is lateral mass of ethmoid bone, which separates the orbital cavity on its lateral side and nasal cavity on its medial side. This is the downward extension of crista galli called perpendicular plate of ethmoid bone. It is important because it will form the upper part of the bony segment of medial nasal septum. This will be upper part of the medial nasal septum. Medial nasal septum. This is the most important part in this presentation, and I'm going to explain using the very schematic diagram. This is the coronal section of the upper part of the ethmoid bone. We have already gone through the ethmoid bone. This is crista galli. This is cribriform plates on either side. Many small foramina are there. Laterally is ethmoidal lateral mass is there. Okay, this is the downward extension of the crista galli called perpendicular plate. Now we are going to continue. Our medial nasal septum consists of three parts. First part, second part, and third part. We start from the first part, which is at the lowest level. The first part is called columella septum. Look here, this is columella of the nose. The cartilage in the columella is we have a major alar cartilages which are U-shaped. This is lateral crust and this is medial crust. This is lateral crust and medial crust. We just mentioned just now, two medial crura of adjacent alar cartilages fuse together and form this septum, common septum, called columnar septum. So this is the very first part, inferior-most part of the nasal septum. Here will be vestibule of the nose, lined by the skin. So above this columnar septum is the second part, called membranous septum. Why we call membranous septum? Two layers of skin, one from right, one from left vestibule will fuse together and there is no bone or no cartilage between them. They are just membrane, so-called membranous septum. Above this is we call septum proper, the third part. In the septum proper, this is the one, the whole thing is the septum proper, very long. So in the septum proper, the first one is cartilaginous septum, this is the one, and the second part is the bony septum. When we are coming up from below, this will be the first bone, vomer bone. The second bone is the perpendicular plate of the ethmoid bone. All together will form the septum proper. Okay, now next is cartilage will be covered by perichondrium, light blue color here. The bones are covered by the periosteum. Then next to that one, outside the periosteum and perichondrium, we have the mucosa layer is here. From here you see here, this is the mucosa layer covering the cartilaginous and bony part right up to here. This is the mucosa layer, which is the respiratory mucosa, the biggest area of the nasal cavity, respiratory mucosa. Above that one is sphenoethmoidal recess. Here will be the olfactory area for smell. So beyond this will be olfactory mucosa. So if you see the septum proper, most inferior is the cartilaginous part, then bony part formed by the vomer and perpendicular plate of ethmoid. They are covered by, cartilage is covered by perichondrium, bones are covered by periosteum. And outside that is, from here to here is respiratory mucosa. Beyond that is olfactory mucosa. Blood vessels and nerves are in the submucosal layer. Medial nasal septum. Refer the diagram. It is made up of three parts. The first part is columella septum. This is the columella septum. We have already discussed about this. The columella septum is formed by union of two medial crura of the major alar cartilage. So it formed the lowest first part of the medial nasal septum. Above that is two membranous septum, which is formed by two layers of skin, one from right vestibule, another from left vestibule, and there is no bones or cartilage in between. This is the membranous septum. After that, we have number 3, septum proper. Septum proper consists of bones and cartilages. The bones are A, perpendicular plate of the ethmoid bone, which is located posterior and superior part of the septum. B. Vomer bone, which is located posterior and inferior part of the septum. In addition to these bones, there are additional minor contributions of medial spines and crests of the surrounding bones. That means small crests coming from the surrounding bones like maxillary, palatine, sphenoid, frontal and nasal bones. These are the small crests. The cartilages are C. This is the cartilaginous septum, which is quadrangular in shape and located anterior to the bony part of the septum. Further anterior to it is the lower nasal cartilage. This is the one, lower nasal cartilage, located further anterior inferior. All the cartilages of the nose are hyaline type of cartilage. Very often, the septum is curved or deviated to one side. Cottle's classification. The nasal septum is divided into 5 areas based on the accurate anatomical position of the disease of the nasal cavity. The areas are number 1, vestibule, number 2, valve at the level of laman nasi, number 3, attic, high up there, number 4, turbinate, where turbinates are located, and number 5, postchoanal area, which is near the posterior aperture. For further information, please see Anatomy DAHAR series, the nasal cavity, blood and nerve supply, lymphatic drainage. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Free medical education. Thank you.